We're not just looking to the now. With our current backbone of network communications and our phone systems, we're looking to the future, to where we can create a hospital system for the future.
Fortunately, in Baylor Health Care System, we envisioned those needs years ago when we built our network.
One of the things that we're most proud about is the fact that we've grown the organization, certainly in the last 7 years, around network capabilities.
And at the core of that technology is a digital network that we've built with an all Cisco environment. It is our digital superhighway that allows us to move imaging, video, data, and voice that greatly enhances and enables better health care.
It is critical that a network and the information technology services be stable in a hospital environment. We can't afford any downtime because it potentially impacts a patient's life.
In Baylor's case, we decided to take the high ground. We wanted to make sure that the investment we were making in an architecture and an infrastructure was going to be something that we had to do right the first time.
It was going to be that foundation that we were laying for our environment, for all future growth of our systems and for the hospitals themselves. And we've seen that growth during a time period that we were able to sustain a reliability of 99.999% uptimes.
I know very few nurses, very few physicians, very few therapists that went into healthcare because they want to write in a chart. They went into healthcare to take care of people.
We've really removed the network and the infrastructure as a barrier to change.
The network in our organization is actually an enabler and a change catalyst that actually is something that would give Baylor a big advantage in the workplace, and it differentiates us from our competitors.
And by having multiple platforms available, multiple different systems available, a cultural evolution will occur that can significantly impact upon the ability to provide care.
It's excellent news for healthcare. Anytime we can use technology to shorten time and distance for your clinicians and doctors, that's improving quality of care.
What we are going to do today is to
Today we use video conferencing over our Cisco network for physicians to actually view both physician consultation and physician live procedures in our operating suite. And we also incorporate, in addition to Voice over IP, the Cisco wireless solution.
In Cisco, what we found is a company who has not only embraced healthcare and healthcare solutions, but also embraced the Baylor vision.
What makes my day is watching a little old lady who's had a stroke be able to walk for the first time. That's what the Baylor system's about. And technology didn't cause that, but it allowed the patient's care providers to be able to do the very best possible care for that individual.